Hello, today we're going through trach suctioning. I apologize for wearing the sunglasses. I have a concussion and the light is just, I'm gonna put these back on. I tried dimming the lights, but then it wasn't picking up anything, so I'm just gonna roll with that, and I'm sorry. I had let Teresa know that I never got my kit that I was supposed to have, so she just said go ahead and verbalize. So that's what I'm gonna do today. I'm really sorry. So we're doing the trach suctioning. Starting with you walk in, introduce yourself, and hi, my name is Beck. I'm gonna be, suctioning out your trach, changing that out. Make sure I have the right patient. So double check their armband, name, date of birth, two types of identifiers. Those are just the two that I typically go with. Before I touch or do anything, obviously, hand hygiene, wash my hands, get that sanitized. If there's like curtains or doors or whatever, go ahead and shut those or, close them, give some privacy. And then make sure that this is what I'm supposed to do to that patient. So double check the order on that. Explain to them what I'm gonna do, and then go ahead and position the patient semi-Fowler, so just up at that nice 45-degree angle. Make sure that they're comfortable, and then to prepare for that, I'm gonna put like a towel or like a large gauze, something or another. It gets a little bit messy, so no need to go ruining a gown or anything like that. See what we've got to work with first, so listening to lung sounds, putting a pulse ox on, seeing if we've got what we have going on, assessing rate, quality of respirations, things like that, sounds and whatnot. Obviously they got a trach already, so put that trach mask on. And then go ahead and crank up the oxygen, because we're going to be pulling that off, so you want to make sure that you hyper oxygenate them beforehand. Once we got that on, we can go ahead and test our suctioning. So turn that on, connect all the hosing and everything. I'm so used to them coming already connected, but you got to connect the hosing, connect the tip, all of that. And then turn it on. I think it's 100 to 150, or 80 to 150. Just make sure it's working with that. And then I don't have my trach kit, so say I have it, and then open it facing away from you so that it stays sterile. There'll be nice sterile gloves in there, so go ahead and put those on in a sterile manner. Don't be touching everything and whatnot once you've got that on. As soon as you do have that on though, oh phooey, I think that's when you're supposed to connect everything, so you're touching it with sterile gloves, not beforehand. So forget what I said before. Once you got your sterile gloves on, that's when you want to connect everything, and then you can go ahead and test it. Touch the tip, make sure the suctioning is working. Before you go inserting anything though, make sure that you've got the tip moist, and you can use sterile water or whatever, so we're not sticking to things and whatnot. So at this point you're ready to go. Go ahead and pull that mask off just below the stoma, or you know what I mean. pull that down, and then go ahead and insert the catheter until you feel pressure, until the patient coughs or something like that. Don't suction on the way in. Just go ahead and not pinch that off, but they got that whatever. Don't suction on the way in. Once you're in depth though, go ahead and you can start suctioning and swirl it around, start pulling it out. Make sure you try to get in all directions as best you can. Don't do it longer than 10 to 15 seconds at the most, because you're depriving them of oxygen while you're doing this. So pull it out, do that. Go ahead and put that oxygen mask back on, and then after you've done that, reassess, keep that pulse ox on, make sure you're not doing bad things there. So put that back on. Listen to their lung sounds again, reassess their breathing, see if that did anything. Did it help? Hopefully it didn't make it worse. But yeah, see if there's anything more to work with. And then if you have to, go ahead and repeat that again. You can repeat it, I think, 2 more times. Wait at least a minute though, like make sure they're getting some oxygen before you do that. So if you have to do it again, repeat the same process. And then after each time, reassess lung sounds, pulse ox, check their breathing, rate, quality, things like that. See how they're doing. Once you've got that decent, and you're done suctioning and everything, you can go ahead and disconnect everything. Take your gloves off in a sterile manner, wash your hands again, make sure we're not spreading any type of infection around, and just go ahead and double check one more time, because so sometimes you can finish tearing everything apart and then it sounds like they're having trouble breathing again. So assess them again before we get started changing out things. Gonna go ahead and change out their trach, so put fresh clean gloves on, and then go ahead and you gotta unlock it, pull it out, and then when you're putting the new one in, only touch the top, and you can lock that back again. And then obviously dispose of the old one in whatever manner. Don't throw it in regular trash, but like biohazard or something like that. And then you've got the new one in there, so go ahead and clean around the area, starting from the front, working your way out, so we're not spreading bacteria and stuff into the site. But you can do that with like a like sterile gauze, or like saline soaked things, or cotton applicator, something like that. And then go ahead and pat that dry and make sure we're all set with that. And then put gauze back under for the drainage, and then you're gonna put the placeholder, take a new one. You can put it on top of the old one just to make sure that you're like maintaining, and then you can take that old one out and you can secure the new one. Make sure you've got it's not too tight. Don't crank down on it. Make sure you can fit a couple fingers underneath so that you're not cutting off anything. And then obviously, that's it, I think. So, take your gloves off, wash your hands again, document appropriately, make sure that they're comfortable, and make sure they don't need anything else right away. And that should be it. All right, thanks for bearing with me.